morning, everyone. I'm Megan Cullip, along here with Scott Michlin.
Good morning, Megan Cullip. Here we are, Friday morning.
Friday morning again.
Once again, here we are together.
We're lucky
We are lucky
to have it again.
I feel very lucky when I get to co-host a show with you.
Yes.
How's that?
That's very nice of you. That's kind of uncharacteristically nice this early on in the program.
I understand that, even though your name is still first on the title slide.
You're going to mention that
I'm going to.
every time.
Until it gets fixed. Look at
that.
Look, it's
travesty.
It is.
As I keep repeating, I think it's just alphabetical.
You think so?
I don't think we need to dig any deeper.
Okay. Anyway, it's good to have you here.
Yeah.
So today we are back with Solutions from the Street, our kind of journalism program looking for solutions, our solutions-based journalism, as we've talked about. And so it's somewhat unique, I think, in the area and in the state. There's not a lot of other folks doing it. There are others, certainly, to their credit.
Right.
And so this week we have a problem.
We do have another problem,
Friday. Well, we have many problems, but specifically the topic of the show
yes.
is specific problem.
Yeah, so how do you feel about dentists, Scott?
I love dentists. I appreciate what they do.
Yeah.
I love them as people. Not my favorite activity when I go to the dentist, and I know they're just doing their job to keep me healthy and my mouth healthy. So, yeah.
Yeah. Mouth looks good.
Thanks.
Yeah.
There you go.
Well, so the problem
It wasn't cheap, but yeah.
It wasn't cheap.
There you go.
Yeah, you have a whole story about that.
That's right. I know.
So
someone's kids went to college, but go ahead.
Good thing yours didn't.
That's right.
So dental anxiety is our problem.
Yeah.
Yes.
And I think there are a lot of people maybe suffer from that.
I think so.
As we will hear probably in a few minutes, but yeah. And that is just kind of that uneasy feeling of going to the dentist, or trepidation of going to the dentist, right?
Our expert can expand the definition of anxiety for us a bit. We might think of it as your sort of run-of-the-mill nervousness, but it might be something more. So
okay.
I think we should bring the expert on.
We have a solution to this dental anxiety problem, and that's why we're here. So there you go. Our expert, Jean Manz, welcome to the program. Great to have you here. Thank you very much. You are our expert because you are one of the co-founders of an organization, and I'm going to really try not to mangle the word.
I'll help you out.
Thank you. Co-founder of Active Anxiolytics.
Anxiolytics, yeah.
Okay.
Yeah.
And so that's a new word for me and probably for many of our viewers and listeners. So what does that mean?
So an anxiolytic is something that helps reduce anxiety. Typically, it's thought of as a medication, maybe like a Valium or something that helps you calm down, that you might take as a pill. But in general, we can think of an anxiolytic as anything that we do that helps to calm the nervous system.
Oh, like take a deep breath.
Like taking a deep breath, or going for a walk, or talking to your mother, maybe.
Or not.
Or not. That could be.
Just say pick a person of your choice. Yeah.
Yes.
Right.
Yeah.
Right.
Right. So active anxiolytics is about active things we can do to help ourselves regulate our anxiety.
Okay.
Yeah.
And so when we talk about dental anxiety, that is part of what this can help with.
Yeah. So I'm a marriage and family therapist, and many people walk into my office looking for some help with anxiety. Pretty universal, human experience, and certainly in pandemic times we've seen an even increase. But so people come in and need some help with anxiety, and so what we do in a mental health setting is teach people about anxiety, that it's more of a physiological state than it is a feeling. And we work with them and teach them ways that they can self-regulate, help themselves kind of calm down. So I've been familiar with dental anxiety for a long time. I'm the daughter of a dentist, and my husband's a dentist. I've had a lot of dental work done myself. So really aware that people have a lot of anxiety thinking about going to the dentist, being in the chair and getting treatment. And so decided to really focus on this area and bring some of the things that I do with my patients in my office and teach people how they might manage so they can get to the dentist and take care of their oral health.
Very good. And so how common is this dental anxiety problem?
So a couple studies that I've seen, one of them was with 18,000 people worldwide, polled 61% said they had fear of going to the dentist. Another study that was really looking at moderate or severe anxiety has found that it's about 31% of the population report moderate to severe. So, a lot of those people might white knuckle it through an appointment, and quite a few of those are avoiding going to the dentist.
Right. And so, I mean, what does this anxiety look like? How do we know we're experiencing it? Can we tell if somebody's experiencing it?
Right, right. We tend to think of anxiety. I think for most of us, you would notice if somebody's anxious, if they're sweating, maybe their pupil size is really big, they're fidgeting. Those are some really classic signs of anxiety. Probably most of us are familiar experiencing or seeing in our loved ones. The anxiety, that's more fight or flight, right? That's this thing in the nervous system we call sympathetic arousal. But when we cannot do anything, we can't move, we can't fight or do anything else to push away the stressor, the body will go into a freeze response. And so that's going to be a more quiet kind of anxiety that we may miss, either in ourselves or with our kids, because it's a de-energized event where the body goes more into collapse. And so you think about your posture is going to move more from kind of being rigid and tense to more flaccid. You may notice somebody with a really flat face and not a lot of movement in their face. You may notice somebody's voice go from feeling really strong to all of a sudden, I'm kind of talking like this. These are signs that somebody is really stressed, but their system has shifted from that high activated state to kind of more of a shutdown state. So that's something that's really important for me to help people understand, because in dealing with patients or our loved ones or even ourselves, sometimes we miss that one and we think, oh, they're cool, they're fine, they're calm and they're not saying too much, or they're trying to just please me, and we can miss that. So that's a super high stress state.
Interesting. And I wanted to ask you too about why dentistry, why dentists, some of the nicest people on earth, and yet, some people don't have anxiety going to the doctor or doing other things, but it's just dentistry that sends them into anxiety. Is that
right? Well, I think there are some specific things about getting dental treatment that can trigger a lot of people to feel afraid, or even evoke maybe some trauma memory if there's been any abuse. If you think about it, when you're at the dentist, you're lying on your back, first of all, right? And so that's a really vulnerable place. You have somebody over you in your personal space. You have to be quiet. You can't move. And so, and there's uncertainty. I think one of the biggest fears, certainly for any of us, is not really knowing what's going to happen. And, dentistry can be uncomfortable, maybe even painful at times. And so the anticipation of what's going to happen can create anxiety. So I'd say for those reasons, there's a lot of things that might make people anxious. And it may not also be that the actual dental treatment experience is bringing it on anxiety, but when we slow down and stop moving, I stop, vacuuming my house and getting to work and doing all the things of life, and I slow down very often, that's when anxiety can kind of pop up, because we're not moving, we're not using that muscle movement and that adrenaline to do something with it. So I think it's a particularly prone time to feel anxious.
Right. Thank you.
Right. And so how do we currently manage this in dentist office?
Well, what I've heard is the primary go-to strategy for somebody who's really anxious would be laughing gas or nitrous oxide. I know most dental providers are really sensitive to this issue and do a very good job at giving information to patients, letting them know what's happening every step of the way. Sometimes even putting their hand on their shoulder, giving some touch. And so there are things that dental providers do already besides just giving sedation. But for a patient who's really anxious and those things don't work, usually sedation is what they use.
So, which is not what that's not your wheelhouse. So what kinds of techniques are we talking about when it comes to active anxiolytics?
Okay. Well, this kind of goes, a lot of my thinking along this line and a lot of what I do really isn't new. Bringing these sort of techniques into a medical setting has been happening since the 70s. John Cabot-Zinn is a pioneer in the work of bringing more, in a sense, active anxiolytics into medicine. He was a pioneer at University of Massachusetts Medical Center, started a program called mindfulness-based stress reduction. And it has been extremely effective and used now worldwide to work with patients in medical settings to help them calm anxiety and actually to reduce the perception of pain. And the things that he teaches in that 8-week course, these are the categories. And some of the techniques that I'm bringing fall into these categories. So the categories would be, one, some mindful awareness, just being aware of thoughts and feelings and what's happening in the body. Body awareness specifically, kind of just tracking what's going on in the body. Movement, he uses a lot of yoga in that work and in some of the techniques I teach. We definitely use movement a lot, sometimes even just movement of the eyes back and forth that we notice can help reduce anxiety. And then the last category would be thinking and cognition, and so being aware of your patterns of kind of what those automatic thoughts are and some of those automatic things that happen in the mind. So we can certainly get into a couple of those if you like.
Can you? Yeah, if you want to demonstrate a couple of them or take us through a few of these, because I'm getting less anxious already. Which is good.
That's my goal, Scott.
You're very good.
Thank you.
That's my goal. All right. Well, I think most people are no strangers that our breath helps regulate our stress response. And so a very simple one is to use slower pacing of the in and out breath to calm anxiety. We know that on the in-breath, the heart rate speeds up, and on the out-breath, the heartbeat slows down. So when we breathe, if we're really anxious, extending and really focusing on the in-breath too much can actually get that, we call it the vagal brake, off of the heart rate and increase heart rate. So as we're breathing, we want to be really aware of lengthening and extending an out-breath. So one cool technique, really simple, it's called 1-2 breathing. And so you're going to just pick a number. I usually start with 3. So what you're going to do is you're just going to breathe in to the count of 3. So it might look like this. In, 2, 3. And then you're going to breathe out to 6, twice the count. So out, 2, 3, 4, 5, 6. Hard for me to breathe in and out as I'm counting.
Right.
Yeah. So that's pacing the breath.
Okay. And if we do that a few times, is that what we should do? We can't just do it once.
You can do it once. I did it once today. Like, weird. Right before I came here, I had a dental appointment.
Okay.
What kind of irony was that?
Right.
And so I'm just lying in the chair, and I was waiting for her to set up her tray, and I don't have terrific dental anxiety, but there is something about just lying there. So I just had a really brief moment as her back was turned to me, and she was setting up a tray to just do a couple, actually, rounds of 1-2 breathing. And So, if you can do it for a minute or so, I find that the counting helps anchor my mind too, especially if, your mind is stuck in worry thoughts. It can almost be like a mantra, right? So that as you count 1, 2, 3 and out and so forth, you count, you have something in the mind to do.
Not thinking about the procedure or whatever is about to happen.
Right.
Yeah.
Right.
I got it.
Yep.
Interesting. And that's one tool, right, of many.
Would be one tool.
Of many that you
Yeah.
that you were talking about this
Yeah.
morning. And for me, I'm always, part of my anxiety, I guess, would be just not knowing, what's coming. And so I always try to tell my hygienist or the dentist or whatever, just let me know what you're going to do before you do it, and then I'll be better about that.
Yeah,
I kind of don't like surprises.
Right.
And maybe just because of what we're talking about, right?
Right. I think feeling empowered, actually is another anxiolytic, right? To be able to acknowledge, I'm a little anxious here, or I don't really know what's going to happen, and can you help me out by letting me know? Is really important, because that uncertainty, first of all, but also like the white elephant in the room. I'm lying here, maybe I'm starting to breathe really fast, or I'm feeling sweaty, and leaving it unspoken and as a white elephant in the room certainly makes it worse, and doesn't give your provider a chance to show some compassion towards you and maybe pull some of their tools out of their toolbox to help you. So
Right.
yeah.
And I would think every dentist wants their patient to have a good experience.
Absolutely.
When they're in the chair or whatever. And, and so whatever they can do to help that patient have a better experience, I think they're more than willing to do it.
Absolutely. And I think a lot of these, just at the dentist this morning and talking to the hygienist about this, she was just sharing with me that she tries to talk to the patient if she notices they're anxious. But one, it's hard to really do your craft, right, and do your procedure while you're trying to verbally support a patient through it. And it also can be pretty exhausting for providers, right, to do that 8 hours a day. So having some different things that you might suggest. So another one you might suggest, it's super easy, that gives some touch to the chest and the belly. So I call it hand on heart. And you just take one hand and you put one hand on the chest like this. And you take your other hand and just put it on the belly. This gives touch, proprioception, to the heart and the belly. And the belly is really involved in the stress response. There's a nerve called the vagus nerve that goes from the top of your head all the way down to your belly. And it's why when we're nervous, oftentimes we have digestive issues, right? So simply putting a hand on the heart and a hand on the belly like this, and just breathing, can begin to send signal via this vagus nerve for the relaxation response to go online. So that's an easy one in a dental chair.
Right.
Sometimes people like that weighted blanket of the X-ray blanket. Sometimes that can be used in a chair too to give you that, but that might be something you try.
Great. And Jean, you've mentioned something called EFT, and I can't even remember what the acronym stands for, but that's why you're here. So will you talk a bit about that? This comes up a lot in various conversations we have, and so tell our listeners about it.
Awesome. So EFT stands for the Emotional Freedom Technique. And what this is it's tapping on acupressure points on the body. These are acupressure points that are used for acupuncture. And the idea is that tapping on these sends a signal to the body to relax. So actually nowadays, these eye points here, so one of them is inside of the eyebrow like this, and one is outside of the eyebrow, right on that bony part, and then under the eye. And these points here seem to really work to help with the feeling of anxiety and fear. I see quite often now baseball players, athletes in the Olympics before they run their track race, for example. What you're seeing is they're using these eye points to calm performance anxiety. So EFT is a sequence of points that you tap just 5 to 7 times like this that can really help re-regulate the system and be very calming. So for dental anxiety, I mean, that EFT I teach probably 80% of the clients that walk into my office for fear of flying and phobias and all sorts of things. It has a lot of efficacy for that. But with dental anxiety, it's something that one could use driving to their appointment, sitting in the waiting room. If you're in a dental chair and you really can't get to your face, right, because there's somebody standing over you, you certainly could just use this point. This is the karate chop point, and simply holding or tapping this point can be effective.
Do you have an example of just how well these things work? Anecdote?
Yeah. I thought of this with the whole dental anxiety because I do work with a lot of people preparing for medical procedures, but one that relates to dentistry happened maybe 4 or 5 years ago, and I had a mom bring in her 10-year-old daughter who was really scared of the dentist, had a lot of decay going on, needed braces, and needed some teeth pulled actually before she started the orthodontic work, but she would not even get out of the car to go into the office. And so, some nitrous oxide could help when she got in there, but it's going to be a problem if I can't even get my daughter in. So what I did with her is use some of these techniques. First of all, I taught her some of the tapping points. And then what I did with her is called the movie technique. And you basically think of the scenario that you're anticipating having to do. So maybe it's going to the dentist. And you think of it like a movie in your head, right? Like with the sequence of steps. And so I asked her, where do you want to begin the movie? When do you first think you're going to start feeling anxious, right? And she's like, well, that morning when my mom wakes me up. And so we just kind of tracked the body. She gave it a pain scale number 0 to 10. And what we did is we used this tapping sequence as she imagined waking up, her mom saying, today we're going to the dentist. And when we do that, we're actually pairing together the image of getting up in the morning and going to the dentist and kind of living it in your head with doing this tapping sequence that actually we've seen calms the amygdala. That's the part of the brain where there's fear, the feeling of fear is coming out. And so when you can imagine something and now do something that calms that amygdala, right, you're actually going to be moving forward in your life being able to do that with less anxiety. And so in the movie technique, we just kind of go through all of the steps, all the way through to her walking into the dental office. And we did that in a session, and she was actually able to go to the dentist and get her work done and didn't even need sedation. So.
That's pretty powerful considering
Yeah.
how easy it is to do, really.
Yeah,
How
it
simple
doesn't-
and straightforward.
Yeah.
Interesting, very much so. And of course, it seems to me that these techniques that you're showing us and talking about can be useful for dental anxiety, but other anxiety as well. I mean, it seems like they're fairly universal, but maybe they're not.
Absolutely,
They
right?
are.
So the stress response in the body doesn't differentiate whether I'm afraid of flying or public speaking or going to the dentist or whatever it is. It's the same physiological response. So, yeah, my hope is that if people can learn some things, perhaps to help to just get to the dentist, they would also have these in their tool bag to work with themselves and all the other things we got to do to show up in life that can create anxiety. So, absolutely.
Great.
Yeah.
Great. And so you have discussed sort of the core of why you do what you do, and I think it's very beautiful. And so I want to sort of end on this note, and you can expand this note as long as you want. When I say end on it, I'm not saying we're at time yet, but I am saying that I think it's important for folks to hear that this extends beyond just techniques.
Yeah. So what I do in my professional life mostly is couples therapy. That's my love. And in that work, there's really great understanding that relating to other people, we're social beings. We're not meant to live alone. We're tribal. And so we do this thing as human beings all the time in regulating each other's emotions, regulating each other's nervous systems and stress response. And so techniques are super helpful to learn to self-manage. But the other piece of it is we know that just being with another person, having somebody that has a friendly look on their face or softer eyes, or that you just feel compassion from, can help induce safety and relaxation. And so teaching people techniques is really important for self-management, but the other reason I really get out of bed every morning and do what I do is because of the love of meeting people's needs and my own needs. I think, a lot of us have a calling in our professional life because of our own wounds and injuries and that sort of thing, and a deeper understanding of really what the world needs. And so there's super passion for me to be able to be with other people and help them just through presence to feel better.
Thank you.
Very good and commendable. Thank you for doing what you do for folks in our community. I think it's great. And for sharing some of these techniques and insights into the problem of anxiety and specifically dental anxiety today. I think it's been very, very interesting as someone who, again, has been to the dentist many, many, many times and has a little, I would say I have a little bit of anxiety. I think most of us probably do.
Yeah, it's not a super pleasurable experience. I think you're right. Lying on your back is, for me, the most stressful part of it.
Yeah.
So
Bright light in your face.
Yeah, that doesn't help
yeah.
either. But they give you cool sunglasses now. Which is
that's
neat.
true. They do. That's right.
It's
Very, very true.
Yeah.
So, there you are. Well, thank you.
Yes, you're
for
welcome.
coming
Thank you
in.
for having me.
And these are great steps, great pieces of advice, again, that we can use for dental anxiety or a lot of other anxious moments of our lives. So we appreciate
Great.
that.
Yeah.
Thank you very
Thank
much.
you.
Before we go, though,
Yeah.
right? We can always use more ideas,
Yes,
right?
of course.
More, you're like,
Where are you leading me, Scott?
Yes, exactly.
If
To the
you have
email address.
Any problems or problem solvers that you know of, go to KSJE at sanjuancollege.edu and just send us an email. And we are more than thrilled to reach out to folks. We don't know everybody or everything. I know that we
try.
Pretend to know everything.
We try. We do
but
try.
we don't. So go to KSJE.
Some of us more than others, but okay,
Some
whatever
of
you
us
say.
more than, yeah, it's true. You're not wrong.
Okay.
KSJE at sanjuancollege.edu.
There you go. And we can check it out and maybe book them on a future show.
Absolutely.
Because we do this every other week. It is Solutions from the Street, and we are here every Friday, every other Friday with Solutions from the Street. And so next Friday we'll be back with a program devoted to COVID-19, our other favorite topic.
Our other
We're still
favorite problem.
looking for a solution to that street.
We are still looking
And it's a
for
long
solution
street.
on that street. Yes.
But there you go. But anyway, thank you for joining us, everybody. Have a great and safe week. We'll see you next Friday. Bye-bye.